Good afternoon, everybody. My name is Dr. Christopher Atala. I'm a board-certified urologist at Good Samaritan Hospital. I've been given the honor of giving the first lecture in the virtual lecture series, and I've been tasked with talking about prostate health. So, the first thing we need to talk about is what is the prostate? I think most guys know that they have one, but may not necessarily know what it is, what it does, and what can happen to it if you don't take care of it. So, the prostate is a walnut-sized gland that sits below your bladder and surrounds your urethra. And it mostly provides seminal fluid that is vital for sperm and ejaculation. So, now that we know what that is, we should talk about what can go wrong with your prostate. And there's a few things that can happen. One of them being BPH, or benign prostatic hyperplasia, prostatitis, and prostate cancer. So we'll talk about BPH first. BPH refers to a benign, meaning non-cancerous, enlargement of the prostate. Typically, the prostate starts to enlarge around age 40, and even though your prostate enlarges, it doesn't mean that all men that have an enlarged prostate will have symptoms of an enlarged prostate. So, how do you know if you're having symptoms of an enlarged prostate? Some of the things you may experience are increased frequency of urination, waking up more often to urinate, straining to urinate, urgency of urination, a weak urine flow, and even urinary retention, which is the inability to pass your urine. So if you have these symptoms, what do we do to fix it? Typically, the first thing we do as urologists is try and treat the problem with medication. The mainstay of treatment is a medication called Flomax, which is an alpha blocker. The generic name is known as tamsulosin. And what this does is try and help relax the prostate in order to facilitate passage of urine through it. Sometimes your urologist may add a second medication if your symptoms aren't quite where they need to be. A class of medicines called a 5-alpha reductase inhibitor. And those are either finasteride or dutasteride. These medications are usually added in conjunction with tamsulosin, and they actually help shrink the prostate and can shrink the size of the prostate by up to 30%. So, what happens when you still have symptoms, even though you've been taking all these medications, and you still feel like you're waking up too much to go to the bathroom, or you're still straining to urinate, or you can't urinate? Well, the next step is generally surgical intervention. And the mainstay, the gold standard operation, is something called a transurethral resection of the prostate. And that's a minimally invasive procedure that actually shaves down the inside of the prostate to allow urine to flow through it with less resistance. There are newer types of interventions as well, things such as laser ablation of the prostate, urolift, and Resume. And you can discuss these with your urologist. They are all alternatives. They are all measured against the gold standard, which is the transurethral resection of the prostate. All right, so now that we've gone over an enlarged prostate, we should talk about prostatitis. Prostatitis is an inflammation of the prostate and is usually broken down into 4 different types, typically bacterial versus non-bacterial. The 4 types of prostatitis are acute bacterial prostatitis, chronic bacterial prostatitis, chronic non-bacterial prostatitis, and asymptomatic inflammatory prostatitis. So, how do you know if you have prostatitis? Acute prostatitis will usually present with painful urination, difficulty urinating, pelvic pain, and sometimes even fevers and chills. Whereas a chronic prostatitis, meaning something that's been lingering for a long time, usually presents with similar symptoms but a little bit different. And those include painful urination, pain in the testicles, pain with ejaculation, perineal pain, and even pelvic pain. Typically, acute prostatitis is treated with a long course of antibiotics to eradicate any bacteria that may be indwelling within the prostate. We sometimes add that medication, Flomax, that I mentioned before to help facilitate passage of urine. And sometimes if the infection is really bad, you actually may need to stay in the hospital for a few days to take care of it. Chronic prostatitis is a little bit more difficult to treat at times. Sometimes antibiotics work to take care of it, sometimes it does not. Oftentimes the treatment is really directed at your symptoms because every patient may experience symptoms different than the other patient. All right, so last but not least, I wanted to talk to you all about prostate cancer. A few statistics about prostate cancer. It's the most common cancer in men. 1 in 9 men will have prostate cancer. The majority of cases are diagnosed in men over 65, and it's rarely diagnosed under age 40. African Americans tend to have a higher risk of prostate cancer than non-African American men. 90% of diagnosed prostate cancers are non-metastatic. That means that 90% of the time when prostate cancer is diagnosed, it has not spread outside of the prostate to other parts of the body. So what are the risk factors? Who's getting prostate cancer? The 3 biggest risk factors are age. The older we get, the likelihood of having prostate cancer becomes more significant. As I mentioned earlier, African American men tend to have a higher incidence of prostate cancer than non-African American men, and a direct family history. And what that means is if your father had it or your brother has it, you have a higher chance of having it as well, and so you should be checked. So what are the symptoms of prostate cancer? Well, the truth is there really aren't any symptoms of prostate cancer. It tends to be a silent process. You usually don't feel anything, but sometimes you may have symptoms, and that could be a sign of a later stage or more advanced prostate cancer. And those symptoms can be difficulty urinating, pain in your back or pelvis, and increased frequency of urination. So how do we find prostate cancer? What do we test? What do we do? The things that we do to detect prostate cancer are an annual PSA, which is a blood test that detects prostate cancer, and a digital rectal exam. So who do we test? When do we start testing? Who do we test? As per the American Urologic Association, all men ages 55 to 70 should be checked. Some people will say you should start at age 50. However, if you have a direct family history or are African American, then you should definitely be checked earlier, as early as age 40. So how do we diagnose the prostate cancer? We've done all these tests. What do we do next? If your PSA blood test and or your digital rectal exam are abnormal, your urologist may recommend a biopsy of the prostate. And that is an office procedure that uses an ultrasound to guide the biopsy, and 12 small pieces of prostate tissue are taken and sent to a pathologist to tell us if there's cancer or not on the prostate. So if you're diagnosed with prostate cancer, what do you do? The majority of prostate cancers are curable, and prostate cancer is typically a slow-growing process. And there are a couple of mainstays of treatment. One is active surveillance. What does that mean? Active surveillance is a form of monitoring, and it's typically reserved for patients with a very little amount of cancer that is not aggressive, and can typically be watched under the guidance of your urologist. For patients with more intermediate or advanced cancers, treatments include robotic radical prostatectomy, which is surgery to remove the prostate. It's a laparoscopic, minimally invasive surgery. And the other treatment option is radiation. Radiation and surgery have similar cure rates, and that's something that you need to discuss with your urologist in order to determine what may be the best treatment for you. So, how do you prevent prostate cancer? Well, the reality is there hasn't really been a proven regimen to prevent prostate cancer. But in general, you should consider eating a healthy diet that is low in fat, increase your fruits and vegetables, you should exercise, and maintain a healthy weight. This isn't just for prostate cancer prevention, but just for overall well-being in general. So hopefully with all this information, you'll now have a happy and healthy prostate. And if you have any questions, please feel free to call me at my office. I'm sorry, let me just pull up this last slide. I'd be happy to take care of you. You can also check out our website at www.good-samaritan-hospital.org under our Cancer Institute page. Thank you all for listening. Have a good day.